Secretary for Health Lo Chung-mau has slammed a Bloomberg report as misleading and detrimental to the city's COVID fight. The report alleged that Chief Executive John Lee was at odds with Lo on easing COVID rules, including the scrapping of hotel quarantine. Maisie Mock reports.
It all started on Thursday when Bloomberg cited sources as saying that the government was planning to end hotel quarantine in November. While such rumors have been circulating for days, what caused controversy was the report's claim that Chief Executive John Lee was at odds with his cabinet over the plan. It alleged that Lee was leaning towards scrapping hotel quarantine to signal the city is back in business, despite the objections of some in his administration. They included Health Chief Lo Chung-mau, who Bloomberg said wanted to tighten restrictions to create conditions needed to reopen the SAR's border with the mainland. The government neither acknowledged nor denied the allegations that day, only saying it would not lie flat in its COVID battle, a term used by authorities to suggest inaction. The health secretary refused to take the report lying down, however. In a strongly worded article, he questioned the validity of the sources in the report, which he said had tricked readers into believing there was a rift within the government. Risking the media's professional image is one thing, but the report may also affect the government's COVID policies, he said. The surgeon insisted there is no conflict whatsoever within the government, and that the reopening of border to the mainland and overseas is not a zero-sum game. Also giving his take on the COVID development was former Health Minister Ko Wing-man. He brushed aside suggestions that the disease is soon becoming endemic like the seasonal flu.
If we are not certain whether this wave will reach a peak and therefore will quiet down later, then I'm of the view that we are not yet in a position to say whether we can further relax the quarantine requirement for the people who have contracted COVID or for people who return from overseas.
He added with daily cases on the rise, now was not the time to ease COVID restrictions. Maisie Mock, HKIBC.